Okay, so we'll jump straight into how do you normally tell the difference, in adults at least, between influenza and the common cold, those other viruses we talked about before. Well, the first thing to note is that the symptoms are usually pretty sudden. They hit you really hard, really fast, usually within 12 to 24 hours. And then the second thing is the primary symptoms are a little bit different with the flu or influenza. So if you have fever and chills, body aches and muscle aches, fatigue and weakness, and headache, and those are kind of the prominent symptoms, that suggests more flu or influenza compared to the common cold. Now, if you get the flu, it is very likely that you're also going to have those common cold symptoms, congestion, sore throat, cough that accompany it, but they might not be as prominent as the other ones that I mentioned. Okay, great, and that's true in adults, but is that true in pediatrics? Of course not. No, everything is more difficult in pediatrics. So there was this study where they had 353 kids who were diagnosed with influenza and treated in the outpatient setting. So you'll see that fever is the most common symptom and most important in identifying influenza. When you go down though, the next most common were rhinitis, kind of like runny nose, and cough, which are very common in the common cold, and they aren't those differentiating symptoms that we saw before. The conclusion the authors had was listed here. All right, diagnosis of influenza is difficult, especially in the youngest children.